is Cristina Alvarado. Aloe for heavy menstrual bleeding in women with uterine fibroids. Definition. Uterine fibroids can harm sedent manioply during related to heavy menstrual bleeding. Aloe and orange gonorrhea resilience hormone. In Charagoma, the product rapid and reversible suppression of ovarian cells. Women can reduce bleeding associated with fibroids.
Hello, my name is Dr. David Archer, and I will be discussing the results of this Phase 2A proof of concept study investigating the gonadotropin-releasing hormone antagonist ELAGOLIX in the management of heavy menstrual bleeding associated with uterine fibroids. Uterine fibroids are the most common benign tumors affecting reproductive age women, and although patients are often asymptomatic, the disease can present with heavy menstrual bleeding, which is the primary indication for hysterectomy. These tumors are estrogen and progesterone dependent, and hormonal modulation is a mainstay in the management of the disease. However, there is no FDA-approved long-term treatment for heavy menstrual bleeding in women with fibroids in the United States. The serum levels of estradiol and progesterone are tightly controlled by the hypothalamic pituitary axis. Hypothalamic gonadotropin-releasing hormone is secreted in a pulsatile manner from the hypothalamus. After binding to receptors in the anterior pituitary gland, the two gonadotropins, luteinizing hormone and follicle-stimulating hormone, are secreted into the peripheral circulation and stimulate the ovaries to produce estradiol and progesterone. Elagolix is an orally active non-peptide gonadotropin-releasing hormone antagonist that leads to a dose-dependent suppression of gonadotropins and sex steroids. This hormonal suppression is rapid and reversible, and the degree of suppression can be controlled by varying the dose. The objective of this study was to evaluate the safety and efficacy of
Application in nurse. Uterine fibroids are clinical average in approximately 25%. Women who may be present are isotromiral in about 17%. As women do not white women. The main symptom of uterine fibroids is heavy menstrual. These additional symptoms included pelvic pain and painful urinary. Orgasmic problems suggest frequent and difficult entry or contupi and infertility.
My name is Susie Asani, and I'm the director of the Minimally Invasive Gynecologic Surgery Program at the University of Michigan. Today we're going to be talking about abnormal uterine bleeding, which is a very common condition that affects many women in their reproductive years. Abnormal bleeding is any type of bleeding that is irregular. That could be bleeding in between menstrual cycles, bleeding that is heavier than usual during menstrual cycles, bleeding after intercourse, or even bleeding after someone's gone through menopause. There are many different causes of abnormal bleeding, and some might be due to hormonal changes, some might be due to structural abnormalities such as lesions within the uterus, and others might be due to systemic medical conditions. When a woman has a menstrual cycle that occurs greater than 35 days from start to start, less than 21 days from start to start, or bleeding in between their menses, after intercourse, or after menopause. These are all indications that something might be abnormal and she should be examined by her physician. Uterine fibroids are a common cause of abnormal bleeding, and the lifetime risk of developing uterine fibroids is approximately 70 to 80%. Uterine fibroids are benign tumors of the uterus and can cause many symptoms such as abnormal uterine bleeding, which can be either heavy or irregular, pelvic pain, and or pelvic pressure related to the large size of fibroids.
Post a cause. Women with heavy menstrual bleeding associated with uterine fibroids now have a 70 affected female opposed beyond surgery. Allergy is an other gonadotropin release hormone, G8 or it. In women that suppresses ovary sex hormone, allergy word. Kingly, supplement hormone with the 24 habit of starting treatment and while the child have life can be late severity.
Menorrhagia is excessive menstrual blood loss, which typically means any amount of blood loss that negatively impacts the patient's quality of life. For example, we have patients that have to buy a lot of sanitary products. They have to stuff their glove compartment in the car, or have to plan meetings or work around their menses, or they say they can leave home at the time of their menses. Those are perhaps the worst examples. But also, if the bleeding persists for any period of time, anemia can set in, and that has also significant effects such as headaches, fatigue, leg cramps, etc. That would need to be taken care of. We think it's an age-related issue that women typically above the age of 40 and before menopause at 51 tend to have an imbalance of hormones that tend to result in heavy menstrual losses. Technically, what we do is to selectively aim to destroy the endometrium of the uterus while preserving the uterus itself. Now, you have to be able to deliver some sort of energy to cause that destruction. The simplest form of energy is just using hot water.
Usually application to Ecuador. We quedanti trio didenocol level bly placebo control PT sigmod child LRM 1 y 2 Julian fibroid. You have 1 and you have 2. To ask the efficacy and safety of elegant orders of trigader NG. Twice daily without on woman therapy to reduce level of endogenous woman. In the case, daily when G. And already SH or 5 ng when daily in woman with fibroids associated with
Hi, I'm Dr. Lavi Sidhu. Today I'm going to discuss about uterine fibroid, its causes, symptoms and treatment. What are uterine fibroid? These are also known as myomas or leiomyomas. Fibroids are tumor-like growths in the uterus. They are non-cancerous and very rarely develop into cancer. Fibroids are very common in women during the childbearing years, and it may grow along the wall of the uterus as well as into the cavity. So depending on their growth, they are classified broadly into three categories: subserosal, intramural, and submucosal. They can range in size from as small as seedling to a bulky masses that can deform and enlarge the uterus. There can be a single fibroid or multiple ones. In very rare cases, there can be multiple fibroids, which expands the uterus so much that it might reach the rib cage. So, what are the symptoms of uterine fibroids? These can be asymptomatic or symptomatic. Many women might have uterine fibroids sometimes during their lives, but they don't know they have uterine fibroids as they cause no symptoms. A doctor might discover uterine fibroids incidentally during a pelvic examination or a prenatal ultrasound.
Conclusion. Uterine fibroids will significantly other age pain, quality of life, causing pain, and blood syndrome that affects invertebrates for sexual growth to social well-being. Along with additional therapy is effectivity in reduced heavy menstrual bleeding in women with uterine fibroids.
हेलो फ्रेंड्स, मैं डॉक्टर सुशीला सैनी जयपुर दूरबीन हॉस्पिटल से एक बार फिर आपके सामने हाजिर हूँ और आज हम कुछ नई जानकारी के साथ आए हैं। पिछले वीडियो में हमने अधिक महीना आने के कारणों के बारे में जाना था और उसमें हमें पता चला कि फाइब्रॉइड्स यानी बच्चेदानी की गांठें एक बहुत ही कॉमन बीमारी है जो बच्चेदानी में महीना ज़्यादा आने का मुख्य कारण है। और फाइब्रॉइड्स सामान्यतः हर लेडीज़ के टोटल 50-60% लेडीज़ को सामान्यतः उनके रिप्रोडक्टिव एज यानी कि 15 से 45 साल के बीच में कभी ना कभी डायग्नोस हो जाती है। ये बहुत छोटे बीज जैसे भी हो सकते हैं और बहुत बड़े भी हो सकते हैं, यानी कि 2.5 किलो 5 किलो तक के भी ये पहुंच जाते हैं। लेकिन अगर वो छोटे बीज भी अगर आप उनको रोक लेते हैं या 2 सेंटीमीटर 1 सेंटीमीटर का तभी आप डायग्नोसिस करके इसका ट्रीटमेंट करवा लेते हैं तो ये 2-5 किलो तक नहीं पहुँचेंगे, क्योंकि कोई भी चीज़ एकदम से 5 किलो की या 4 किलो की नहीं बनती है। शुरुआत तो ज़ीरो से ही होती है। वो बड़ी किस लिए होती है? क्योंकि हम उसका ध्यान नहीं रख पाते, अपनी सेहत का अपन इग्नोरेंस करते हैं, हमने टाइम पे सोनोग्राफी नहीं कराई या अपनी समस्या को अपन ने टाइम पे ध्यान नहीं दिया। फाइब्रॉइड्स एक बहुत ही बेनाइन डिजीज़ है जिससे कोई कैंसर नहीं बनता है। बहुत रेयर है कि लाख में एक में कैंसर डायग्नोस होता है, बट अगर लाख में भी एक में भी निकलता है तो आप उसे इग्नोर ना करें। अगर आपको महीना ज़्यादा आने की समस्या है और उसमें अगर आपको फाइब्रॉइड डायग्नोस हुए हैं तो चिंता करने की कोई बात नहीं है। दूरबीन के एक छोटे से चीरे से हम फाइब्रॉइड्स का माइमेक्टमी टेक्निक के द्वारा बच्चेदानी को बचाते हुए उसका इलाज कर सकते हैं और आप 24 घंटे के अंदर अपने घर जा सकते हैं, 7 दिन के अंदर अपने काम पे वापस आ सकते हैं। बिल्कुल चिंता ना करें और दूरबीन के छोटे से ऑपरेशन से अपना इलाज कराएं, अपना सेहत का ध्यान रखें और अपने परिवार का ख्याल रखें। धन्यवाद।